Okay, so here's a rundown on a rather complex, unfortunately, situation or concept of dynamic rotation in the spine and body. So basically, we want to try to boil this down to somewhat of a two-dimensional concept, even though it's obviously three-dimensional with movement. It's something that we use with walking. So if you think of like walking as like you kind of load, shift to one side, and then we have to be able to extend. So we kind of load and then extend, and then we lift here. So there's a hip, we'll just look at the hips here, flexion, and then extension, and then flexion. So there's a flexion and loading, and then a flexion and offloaded. So one flexion and loading leads to extension and loading, leads to flexion and offloading. And that's kind of that sequence, kind of rapid fire. So if you have difficulty in going into one direction, where you're loading into extension on one side or extension on the other side, you want to be able to identify that and then treat it and balance things out. It also usually is telling in just how you hold yourself in weight bearing, even in static. It's just easier to usually identify and treat in dynamic situations like that. So that's where we're kind of looking here. But there are other facets to look at with that as well. So anyway, so you can much more easily identify these problems when you're sitting because there's not a lot of wiggle room. So I've just got my hand in the crease here in the groin, and I'm going to try to shift, kind of hinge and then lift, and I'm kind of like bringing that marching up and comparing to this. So I'm kind of looking to see which one feels tight, stiff, like if it's difficult to lift the leg, or maybe you can't lift the leg at all, or can't even shift your weight, or it's just painful. That's a pretty good indicator that it's a problem for you. Okay, you probably notice something along those lines. So if you can't do it in sitting, or you just want something that you can easily stretch into or something, you're gonna wanna go on your back here. So we're gonna go something like this. So I'm gonna be here, my back. So I was having maybe trouble going this way when I was sitting, so I'm gonna come here maybe. I'm gonna kind of rock my pelvis in that direction that I was having difficulty. Make sure that it's from basically the bra line. I can anchor down, pressing everything I can to the table, and just kind of loosening things up in that general direction. So that's the first component. It's like the horizontal if we're looking two-dimensionally. Okay, and then the second component is gonna be like the vertical. And if I'm having trouble, I can use my hands, or like a belt or towel or stretching strap to kind of help that. And I can kind of do it maybe both together, right here, or I can do them, combination or stretch, or I can kind of bring it over my leg and kind of rock, maybe like that. And you might get some pops or cracks in your back, just make sure it's nothing painful. Kind of work that, and bring the arms up to stabilize or stretch, okay? And then maybe work into a more dynamic kind of lifting, kicking, as long as you're not getting pain or pinching there as well. But there might be some tightness, so I can go more vertical, bring it across, diagonal, or just straight horizontal. Some combination of those things, and then we can come on up and then retest and see if that's easier, and it is. So I want to make sure I can go back and forth and free that up. And of course, in standing, make sure it's not painful or bothersome in any way. So that's how you free up your back if it's having some trouble, or hip or whatever it might be.